I'm David Nolen. I am a physician and co-founder and CEO of Tibalink. I've been partnering with Kala to help develop this new technology platform to help solve several of my own problems and problems that my colleagues have with medical information and medical communication. And I think this app and platform will be something that'll be useful for many people around the continent of Africa. And so a typical day starts with rounding on your patients in the wards, coming either to clinic if you're going to be outpatient in clinic, or then going to theater. Also throughout the day, responding to consults from various people around the hospital and also from around Kenya and then around the region. Tibalink will allow you to collaborate, connect, and also receive consults. And I think that will help your business, it helps your patients. To me, I think Tibalink is a win-win for both the providers and the patients, because if providers can see somebody and send them to somebody who may be more specialized in an area with all the appropriate data, the provider they're sending it to benefits, the patient benefits, you can save on time and effort. And so that's how I think Tibalink is going to help, is by collaboration, communication, and organizing data. Communication is such a challenging part of medicine. You have nurses who are rotating on and off constantly. You have residents who are rotating on and off of the service, med students, consultants, and the chain of communication at any hospital around the world is a challenge. Each hospital has unique challenges, but I think one thing that's common is the ability to communicate within your hospital and your team as well, and then the ability to be able to communicate within others in your region. And so there's always a challenge of how do you effectively communicate with somebody. And I think here in this context, at Kajabi Hospital, I would frequently see very unique cases, and being one ENT provider who subspecialized in one area, I would need to communicate with people who are subspecialized in other areas of my field. So frequently needed to try to communicate with photos of a patient or with CT scans, pathology reports, and get their feedback. And so that was something that just kept building and building. I think a platform like Tibalink could easily be built upon. If you can build a network of physicians, it'd be so easy to do something like introducing a radiology service, where if we're sending somebody out to get an MRI, it gets sent to us digitally instead of someone coming with a soft copy and a paper report. It's sent to us as soon as it's read. We can look at it too. You can consult with other people. There's so many different ways that you could build on it, I think.